A heart attack can happen to anyone, but the situation becomes even more dangerous if you're alone. In such a moment of panic and confusion, it's important to know what actions to take to give yourself the best chance of survival. In this video, we're going to walk through 5 key steps that can help you handle a heart attack if you're alone. Remember, the steps we discuss are critical to follow immediately after you begin to experience symptoms of a heart attack. The quicker you act, the better your chances of survival and minimizing damage to your heart. Step 1. Recognize the symptoms. The first and most crucial step when dealing with a heart attack is recognizing the symptoms. A heart attack can strike unexpectedly, and being able to identify the signs can save your life. The symptoms can vary from person to person, and they may be subtle or severe. It's important to listen to your body and pay attention to what's happening. Here are some of the most common symptoms to watch out for. Chest pain or discomfort. This is the most well-known symptom of a heart attack. It often feels like pressure, tightness, or squeezing in the chest. It might feel like an elephant is sitting on your chest, or it could feel like a band is tightening around your ribcage. The discomfort may also be sharp or stabbing, but in many cases, it's more of a dull, heavy ache. The pain can come and go, and it can last for several minutes. Pain in other areas of the upper body. The pain from a heart attack doesn't always stay confined to the chest. It can radiate or spread to other parts of the upper body, including the arms, especially the left arm, back, neck, jaw, or stomach. Sometimes the pain can feel like an intense, dull ache, or you might experience a shooting or burning sensation. If you feel any discomfort or pain in these areas, it could be a warning sign of a heart attack. Shortness of breath. One of the more frightening symptoms of a heart attack is feeling out of breath, even when you're not exerting yourself. You may feel like you can't catch your breath or like your lungs are heavy or constricted. This can occur at rest without any physical activity and may happen suddenly. It's important not to dismiss shortness of breath, as it can be a significant indicator of a heart attack. Cold sweat or nausea. Feeling clammy or breaking into a cold sweat is another sign that something may be wrong. This might accompany the chest pain or discomfort and can also happen without chest pain. Some people also experience nausea or vomiting during a heart attack. If you feel suddenly sweaty or nauseated, especially in combination with other symptoms, it could indicate that your heart is in distress. Lightheadedness or dizziness. Heart attacks often cause dizziness, lightheadedness, or even fainting. You might feel like you're about to pass out or that the room is spinning. This symptom can be caused by a lack of oxygen reaching the brain or by low blood pressure. It's important to pay attention to any sudden feelings of dizziness or faintness, as this can signal that your heart is struggling to pump blood effectively. Other signs. While the above symptoms are the most common, some people may also experience pain in the abdomen, sudden weakness, or even confusion. It's important to trust your instincts. If something feels wrong or if your body is telling you that it's in distress, it's better to be cautious and act quickly. If you experience any of these symptoms, especially if they persist or worsen, it's critical to take immediate action. Heart attacks don't typically go away on their own, and waiting it out could result in more damage to the heart muscle. Even if the symptoms are mild, or you're unsure whether you're having a heart attack, don't hesitate to seek help. Every minute counts when it comes to heart attacks, so don't ignore the signs. Step 2. Call emergency services immediately. Once you've recognized the symptoms of a heart attack, the next step is to call emergency services right away. Don't wait to see if the symptoms improve or if you feel better. If you're alone and you suspect you're having a heart attack, the best thing you can do is call for help immediately. Do not attempt to drive yourself to the hospital. A heart attack is a medical emergency that requires immediate attention, and the longer you wait, the more damage can occur to your heart. Calling emergency services ensures that help is on the way and that you will receive the proper care as soon as possible. Emergency medical teams are trained to deal with heart attacks, and they can provide the necessary treatment before you even reach the hospital. They will be able to monitor your condition, provide you with oxygen, and start life-saving treatments like medications or CPR if necessary. Here's what you need to do when you call for help. Stay calm. It's normal to feel scared or panicked, but try to remain as calm as possible. The more clearly you communicate with the emergency operator, the faster they can send help. Deep breaths and focusing on the task at hand can help keep you steady. Provide your location. Be sure to clearly tell the operator where you are. If you're in a building or a complex with multiple entrances, specify the closest entrance or landmark. If you're outside or in a more remote area, try to describe your surroundings so they can reach you without delay. The quicker they can find you, the faster they can help. Describe your symptoms. Tell the operator exactly what you're feeling. Be as specific as possible. Mention chest pain, shortness of breath, dizziness, nausea, cold sweat, or any other symptoms you're experiencing. The more information you provide, the better prepared the medical team will be when they arrive. Mention your medical history. If you have any relevant medical conditions, such as a history of heart disease, high blood pressure, diabetes, or if you've had a heart attack before, make sure to mention these. This information will help the paramedics prepare for the type of treatment you might need. Stay on the line. Don't hang up until the operator tells you to do so. If you're able to speak, they may ask additional questions to get more details about your condition. If you're having trouble speaking due to the symptoms, try to provide brief answers or speak in short phrases. The operator will understand if you're struggling to talk and will provide guidance. Don't delay. Even if you're unsure whether you're having a heart attack, it's better to call for help right away. Heart attacks can mimic other conditions, but it's always better to err on the side of caution. If you wait too long, the situation could worsen. It's always safer to get help and find out it wasn't a heart attack than to wait and risk the consequences of not acting. By calling emergency services right away, you're ensuring that help is on the way. This step is vital for survival and for minimizing damage to your heart. Step 3. Chew an aspirin, if safe. If you're conscious and able to take action, one of the next steps is to chew an aspirin. This can be a critical part of reducing the severity of the heart attack and preventing further damage to the heart muscle. Aspirin helps thin the blood, making it easier for the heart to pump blood through the arteries. By reducing clotting, aspirin can help stop a blood clot from growing larger, which might otherwise obstruct the blood flow to the heart. Chewing the aspirin, rather than swallowing it whole, is important because chewing allows the medication to be absorbed into your bloodstream more quickly. This quick absorption can begin working almost immediately, helping to prevent further damage to the heart muscle during the wait for emergency responders. However, it's essential to remember that not everyone can take aspirin. If you have a known allergy to aspirin or have been advised by your doctor to avoid it, such as if you have certain conditions like bleeding disorders or gastrointestinal issues, do not take aspirin during a heart attack. In this case, don't waste time looking for aspirin. Instead, focus on staying calm, following the other steps, and ensuring help is on the way. In cases where you're unsure about whether you should take aspirin, or if you've never been advised by your doctor about it, you should always follow your doctor's recommendations regarding medication. If you're not able to take aspirin, you can still take other critical actions, such as calling emergency services and remaining calm until help arrives. Remember, aspirin can be very beneficial if taken correctly, but it's not a replacement for professional medical care. It's only one small part of the bigger picture when it comes to surviving a heart attack. Step 4. Stay calm and rest. Waiting for help to arrive after you've recognized that you're having a heart attack can feel terrifying, but your actions in this time are crucial for improving your chances of survival. The next step is to stay calm and rest. It's essential not to panic, as panic can elevate your heart rate and blood pressure, making the situation worse. When you're feeling overwhelmed by symptoms, it's important to take a few deep breaths. Slowing your breathing can reduce stress, help lower your heart rate, and keep your mind clear. Try to focus on staying calm and avoid thinking about what might happen next. Resting is also vital. As you wait for help to arrive, it's important to stay as still as possible. Sit or lie down in a comfortable position that doesn't strain your body. If you feel dizzy or lightheaded, it may be best to lie down with your head slightly elevated to reduce the risk of fainting. Lying down can help lower your heart's workload, and the elevated position might ease the strain on your circulatory system. Avoid any physical activity, as this can exacerbate the heart attack. The goal here is to minimize the exertion on your heart and give it the best chance of functioning while you wait for medical professionals to arrive. Staying connected with emergency services is also important. Keep the phone line open with the dispatcher so you can receive ongoing guidance and updates about what to do next. They may give you instructions on how to continue caring for yourself until paramedics arrive, and they will inform you of what to expect when help does arrive. The more calm and prepared you are, the better it will be for your physical and emotional state. While you wait, you can continue taking slow, deep breaths. Breathe in deeply through your nose, hold it for a few seconds, and then exhale slowly through your mouth. Focus on the rhythm of your breath and try to clear your mind. Staying composed and focused will help maintain your heart's function while you wait for medical help. Step 5. Use CPR if necessary. In a worst-case scenario where you lose consciousness or stop breathing, the final crucial step is performing CPR, cardiopulmonary resuscitation. CPR can save your life by maintaining blood circulation to your vital organs, especially the brain, while waiting for emergency medical personnel to arrive. If you lose consciousness, it's essential that CPR is started as soon as possible. If you're alone and lose consciousness, you may not be able to perform CPR on yourself in the traditional way. However, there is still something you can do to keep blood circulating until paramedics arrive. Chest compressions. Here's what you need to do if you're alone and need to attempt chest compressions. Position yourself properly. If you're conscious enough to attempt chest compressions, position yourself flat on your back on the ground or on a hard surface. Make sure your head is tilted back to open the airway. Perform chest compressions. Place your hands one on top of the other in the center of your chest, between your nipples. Use your upper body weight to press down hard and fast. Compress the chest at least 2 inches deep and at a rate of about 120 compressions per minute, similar to the beat of the song "Stayin' Alive" by the Bee Gees. Continue until help arrives. Continue doing chest compressions without pausing, unless you feel too weak to continue. If you're unable to perform full chest compressions, try to maintain some rhythmic pressure. Keep up the effort as best as you can, while staying as calm and steady as possible. If you're not familiar with CPR, don't worry. Emergency dispatchers can guide you through the process over the phone. They will provide clear instructions on how to continue and help you maintain the rhythm of chest compressions. It's important to follow their guidance closely, as they are trained to assist you in emergency situations. Remember, CPR is designed to buy you precious time. While you wait for professional medical help, CPR can keep your heart and brain supplied with oxygen-rich blood. This can make a difference between life and death, especially during the critical minutes following a heart attack. The importance of quick action. Every second counts when you're experiencing a heart attack. The quicker you act, the better the chances of saving your life and reducing long-term damage to your heart. Time is critical, as the heart muscle starts to suffer from a lack of oxygen after just a few minutes of the heart attack. That's why the first 3 steps we've covered, recognizing symptoms, calling for help, and taking aspirin if appropriate, are so vital. Even though it may seem like there's no rush, the reality is that heart attacks can cause severe damage in a very short amount of time. This is why it's so important to be prepared and to understand what actions to take, so that you're not caught off guard in a moment of panic. The longer you wait, the more damage your heart can sustain. Immediate action can help minimize that damage and improve your survival chances. What happens after you call for help? When paramedics arrive, they will immediately assess your condition and begin providing the necessary treatment. Their primary goal is to stabilize you and get you to the hospital as quickly as possible for further evaluation and treatment. In the meantime, your role is to remain calm and let the medical professionals take over. By now, the initial steps you took, recognizing the symptoms, taking aspirin, and calling for help, will have bought you precious time, which can make all the difference. If you have any other medical conditions like high blood pressure, diabetes, or a history of heart disease, make sure to tell the paramedics. They will want this information to provide the best care for you. Emergency treatment at the hospital. Once at the hospital, doctors will perform tests to determine the extent of the damage caused by the heart attack. They may use imaging techniques like an ECG, electrocardiogram, to monitor the electrical activity of your heart and check for any irregularities. Depending on the severity of the heart attack, treatments may include medication to break up the blood clot, angioplasty, a procedure to open up blocked arteries, or even bypass surgery in extreme cases. These treatments are designed to restore blood flow to the heart and prevent further damage. It's important to know that the sooner these treatments are started, the better the outcomes. That's why it's critical to act quickly in the early stages of a heart attack. The faster blood flow is restored to the heart, the less permanent damage will be done, preventing heart attacks in the future. While surviving a heart attack is incredibly important, It's just as essential to focus on preventing future heart attacks. After surviving a heart attack, it's crucial to work with your healthcare team to manage your heart health. This includes following a healthy diet, low in saturated fats and high in fruits, vegetables and whole grains, engaging in regular physical activity, as recommended by your doctor, managing stress levels through relaxation techniques or therapy, taking prescribed medications to manage blood pressure, cholesterol or diabetes, quitting smoking and limiting alcohol intake. Prevention is key to living a long, healthy life after a heart attack. By making these lifestyle changes and following your doctor's advice, you can help protect your heart and reduce the risk of another heart attack. Key takeaways. To summarize the 5 key steps to handling a heart attack when you're alone, recognize the symptoms of a heart attack, including chest pain, shortness of breath, dizziness, and nausea. Call emergency services immediately. Don't attempt to drive yourself to the hospital. Chew aspirin if you're able, and it's safe for you to do so. Stay calm and rest while waiting for help to arrive. Avoid exerting yourself and keep your breathing steady. Perform CPR if necessary. If you lose consciousness and stop breathing, CPR can save your life. Quick action is vital when it comes to heart attacks. By recognizing the symptoms, acting quickly, and following these critical steps, you increase your chances of survival and reduce the risk of long-term heart damage. Conclusion: be prepared. It's a scary thought to face a heart attack while alone, but knowing the right steps to take can make all the difference. With the right preparation and a calm approach, you can handle the situation effectively. Always be proactive in understanding your health and be aware of the risks you face. It's also important to have a plan in place in case of emergencies, whether it's learning CPR, having a list of emergency contacts, or ensuring your home is equipped with easy access to medical supplies. Remember, heart attacks are a medical emergency, and the faster you take action, the better your chances of survival. Stay informed, stay calm, and know that help is always just a phone call away. Thank you for watching. Stay safe, take care of your heart, and don't hesitate to seek help if you feel unwell.